Hi, this is Anna Marie Askin Evans with Center for Holistic Psychotherapy, and welcome to our continuation of Minds of Youth Matter series. So today what we're going to do is we're going to talk about depression in teenagers. But I need to remind our audience that this is a psychoeducational format. It is not to be considered therapy. If you find that you need to find a mental health professional in your area, please go to psychologytoday.com, plug in your zip code, and a therapist or group of therapists will come up in your area. So today, again, we're going to talk about depression in teens, and it can manifest so differently than it does in adults. It may be manifest as continued feelings of sadness that can really interfere with their daily functioning, emotional functioning, and even sometimes physical functioning. There could be countless reasons why their depression manifests, but some things to kind of consider is that in the teen years, there's a lot of peer pressure for acceptance and socialization. Those physical changes in the body, along with pressures for academics, and even in the home environment, and even the brain, the chemistry of the brain may be experiencing some imbalances as well. So these symptoms can vary in severity, and so here's some things that we're going to ask you as a teen or a parent or a friend. If you notice this in a teenager, take note and see if early intervention can take place. So there could be just sadness or crying, abrupt crying for no apparent reason. There's no rhyme or reason for it. Anger, agitation, and annoyances at people or even small things. You may want to look at that. Is there irritability? Now, again, this is constant. People are going to have their moods and they're going to have their bad days, but just to keep note of that as well. Loss of interest in activities that they may have once found pleasure in, that they really enjoy doing. There could be some isolation as well. They could be losing interest in connecting with family members and friends, or there might be conflict or drama that's created in those relationships as well. Low self-worth, low self-esteem. Again, self-esteem, want to look at is they're basing their importance and their self-worth on what other people think of them. So if there's peer pressure, socialization issues, things like that, they're trying to define who they are and questioning their self-worth. They may also require constant assurance so that they don't feel rejection. With that said, look for if there's a lot of perfectionism, self-blame, or that they're critical, they're self-critical. They may also be having really a lot of trouble focusing and trying to make decisions, along with also just memory. And so the other thing that you want to look at, and this is important too, is what is their outlook on life? And if you see that there's a hopelessness or a bleakness to it, that is a sign too that they probably need some sort of mental health intervention. But most importantly, if you hear or see self-harming behaviors or suicidal ideation or a fixation to death, don't ignore these symptoms or these signals at all. So what happens too is we want to look at what are some of the behavioral changes. They could have lack of energy. Teens, get tired and they're busy, they go to school, but is there constant fatigue? Are they having disturbances in their sleep patterns, whether it's insomnia or they're sleeping too much? Appetite changes too. Are we losing our appetite and are we losing weight, or are we overeating and perhaps weight gain happens? Big one here is the use of alcohol, drugs, or other substances, including nicotine and vaping as well. We're seeing that can start to cause or behavioral changes as well. Physical manifestations, constant headaches, stomach aches, body aches. The other thing too, behaviorally, if they're starting to isolate, are they isolating from their family and friends? Yes, teens like to have their privacy in their room, but to what degree as well? Look at their academics. Are their academic performances, are those starting to fail a little bit? Or absences, is there more truancy happen, and no, they're not having a motivation to go to school? How about their self-care? Are they really kind of taking care of their own personal hygiene as well? They may have what we call emotional deregulation, where there's anger outbursts or just poor decision making, and also risky behaviors as well. Self-harming behaviors and suicidal ideation are other behaviors that you want to observe. Once again, never ignore self-harming behaviors, suicidal ideation. If get to a therapist, a doctor, a school counselor. If they're in an acute state, then you can always either call 911 or take them to the nearest emergency room for evaluation. It's really important to understand that teenage depression needs to be treated with professional interventions. And it's not going to go away by just getting over it, or you're going through a phase. The more that early intervention takes place, the more success we have in treating depression. And we try to start with more of a cognitive behavioral approach as well, along with other interventions. So if you know of someone, or even you're feeling this way, whether you're a teen yourself, whether you're a friend of a teen, or you're a parent or a family member who might be depressed, who displays this hopelessness, please reach out to a professional, their support system. And you can always call the suicide prevention hotline, and it is anonymous, 1-800-273-TALK. So stay tuned as we continue to discuss teen depression. We're going to talk next about causes and how to support our teens as they go through their depression. So remember, minds of youth matter. You matter. Until next time.